Hi, I am Dr. Deepak, working as a specialist pediatrician in Saudi German Hospital, Dubai. So here I am with my colleagues, Dr. Rachel, Dr. Mirvat, and Dr. Hala. We are about to discuss about allergy in common for a normal person. So let's start with that. Dr. Rachel, please introduce yourself.
Hello, lovely to meet you all. My name's Dr. Rachel Kaminsky. I'm a pulmonologist and a specialist in allergies at Saudi German Hospital. I moved here from the UK a couple of months ago, and I'm delighted to be joined by my other specialists with allergic disease talking to you today.
Hello, everybody. I'm Dr. Mirvat Osman. I'm pediatric specialist. I work in Saudi German Hospital, Dubai, Mother and Children Hospital. I'm graduated from Syria Tishreen University, and I continued my study in Canada, and I worked with Health Canada and Ottawa University in the research of allergic diseases in children.
Dr. Hala.
I am Dr. Hala Kamal. I am Associate Professor of Pediatrics. I am working as a pediatric specialist at Saudi German Hospital, Allergy and Clinical Immunology.
Thank you everyone for coming here. So without wasting time, I would like ask Dr. Hala, can you tell us more about allergy? What it is actually for a normal person?
Allergy is an abnormal, exaggerated response from our immune system to an allergen. The allergen might be something that we inhale or something that we eat. So it might be aeroallergen or food allergen. Before the allergic process happens, there is a step, we call it sensitization. This is the process that the immune system will react with the allergen first. At that time, there will be no symptom. Once there is symptoms started to show up, this is allergy. So the allergic response starts by production of immunoglobulin E. This immunoglobulin E attaches to the certain specific receptor on the mast cell, and then accordingly the mast cell start to degranulate or release mediators. That mediator will be responsible for the allergic symptoms, which has different manifestation. Allergic symptoms might be in the airway, like cough, sneezing, itching. It might be in the skin, like itching, itchiness, pruritus, might be in the GI, like vomiting, diarrhea, crampy abdominal pain. The allergy in general, it takes different process to understand. This is the direct way to understand the allergy. But there are, unfortunately, other ways that's concealed. We will not know the allergy unless we eliminate and reintroduce. Let me explain. Like for those who are having another pathway of the allergy, like non-IgE mediated reaction, those we will not know by any test. This is, we will diagnose the allergy by elimination and reintroduction. So I will move now to the next part, which is the diagnosis of allergy. How we'll diagnose allergy? Number one, and the most important, is the history taking. The history is very important because according to the history, I can interpret all the symptoms and the signs that I'm encountered in the patient. There are several diagnostic tests for the allergy. The direct one, we measure the immunoglobulin E in the blood, and there are another way to detect also the specific immunoglobulin E in the blood. There are another way also to diagnose the allergy by skin prick test, which is a very simple test, can be done from infancy, and at this test we apply most of the allergens that we are incriminated on the skin, and this test can be interpreted within 15 minutes. Other diagnostic tests can be done as well, but these are the most common that we usually depend on, beside the history taken, as I insist upon, because this is really very, very important. Now we go to the how we manage the allergy in general. In general, allergy is a kind of inflammation. So to treat the allergy, we treat by corticosteroid, which is an anti-inflammatory. We treat the allergy as well by antihistamine. Another way to treat the allergy is to provide the patient with what we call it immunotherapy. Immunotherapy, it is a sort of the desensitization. We provide the patient by gradually increasing doses of the allergen to provide tolerance. And recently we have in Women and Children Hospital other new modalities of therapy like immunoglobulin E, like a lot of biologics, which is fortunately started to be approved in children as well.
Thank you, Dr. Hala. It was very lucid explanation about how to understand the allergy. So that's fantastic. So now I would like to move to Dr. Mirvat. As Dr. Hala told us about that allergy can present in any part of the body. Can you explain something about allergy on the skin, that is atopic dermatitis or eczema?
Yeah, with pleasure, Dr. Deepak. Actually, we have four main manifestations of skin allergies in children. All of them are very known to children, and we see them in different ages. The first one is urticaria or hives. The second one is the angioedema. The third one is the contact allergic dermatitis, and the fourth one is eczema. Let me quickly tell you about the first two types of the skin allergies. So for the hives, I believe most people have seen them on their children. It's like some red patches that are a little raised over the skin, very itchy, and then they can change their appearance from time to time or from part to part in the body. So they are very itchy, very irritating. The reason behind this is the same reasons as Dr. Hala mentioned, but we also see these sometimes after infections like viruses and some other infections. This is swelling on the surface of the skin, but if the swelling is under the skin, we see what we call angioedema. It's puffiness in the eyes, puffiness in the face, swelling in any part of the body, but we care most when the swelling is in the larynx, because then this will affect the breathing of the child and will put him in danger. So this is actually what we call anaphylaxis, and this is where the parents should be aware of this condition, should be fully prepared. There is some, let me say, home treatment that they can do. It's the auto-injection of the EpiPen. So whenever the child is at risk of this kind of severe allergic reaction, usually we prescribe the medicine. We tell the parents everything about how to deal with such an emergency.
And you were talking about eczema also on the skin. Can you elaborate a little more?
Of course, doctor. Eczema also is very common. It is like dry patches on the skin, severe dryness. The whole skin of the child will be dry. But these patches are mainly seen on the elbows, behind the knees, on the wrists, and sometimes we can see over the cheeks and all over the body, especially for babies who have the cow's milk allergy. So also because of the dryness and irritation, there's severe itching, scratching, the child scratching himself all the day and night. Sometimes this goes for secondary infection, especially bacterial infection, and then special treatment for the infection should be used. Sometimes we see this eczema in certain areas like the hands and the face, for example, and the wrist. We call it contact dermatitis or contact atopic dermatitis. This happens after contact with a substance that this person is allergic to. And the body considers this like an enemy, although it's a normal substance that many people can use. We saw this most on the COVID era, where people used to use sanitizers for their hand. We see them with jewelries. We see when children are using slime to play with. So the treatment for this one, obviously, is to avoid the notorious substance, and everything will be back to normal.
So what do you specifically use to treat eczema for the kids? Specifically when they come to you for the dry skin?
Yeah, sure. Yeah, eczema is severe dryness in the skin. So what usually we do, we try first to decrease the itching and decrease irritation by antihistamine, especially second generation of the antihistamine oral. We use some topical corticosteroid to decrease. Of course, there is no cure for eczema. The cure is by doing one of the tests that Dr. Hala mentioned. And then if we knew the reason, the eczema will vanish. If we knew that this child is allergic to to animal, to cat, to food, to eggs, when we eliminate this one, the treatment is 100%. But if we couldn't find, then we have to use extensive moisturization for the body, plus some instructions. We tell the mothers about the caring, bathing, and the shower gel she has to use, plus the topical corticosteroid, plus new treatment like Dr. Hala mentioned about the medicine are new now in the market.
Thank you so much, Dr. Mirvat.
Thank
It
you,
was
Doctor.
fantastic explanation about this.
Thanks.
So now we'd like to move to Dr. Rachel. You are a pulmonologist. So I would like to ask something about, for the adults, how do they get asthma and what is allergic asthma as such? Can you explain about?
Of course. So allergic asthma is very common, unfortunately, and in Dubai, 1 in 5 people suffer with asthma. Allergic asthma is much more common in childhood, and if you're a younger adult. And what that is, it's when there's an allergen, which is airborne, that's then exposed to the airway epithelium, causing an unnatural increased reaction from your body's immune system that wouldn't happen in a normal individual. There's lots of common allergens, unfortunately, and we can't always eliminate them. So dust is a really common allergen, mold, which particularly can be in air conditioning units, and also any animal dander that people can become exposed to. And this then is inhaled into the airways, and the airways think they're under attack, and they send out a distress signal and cause lots of other inflammatory cells to come into the airway, causing swelling and narrowing, which gives the unfortunate symptoms that people with allergic asthma have.
Right. So what kind of symptoms they actually can feel before they come to you and you diagnose them with asthma? Because somebody can have wheezing after an infection as well. So how do you differentiate that? How do you diagnose it?
So, as Dr. Haller said, the diagnosis is 99% in the history taking.
Right.
So you need to talk to your patient. You need to find out if they have a family history of asthma.
Right.
Unfortunately, it's very common if you have either a mother or father with asthma, you have a 2.5-fold increased chance of developing asthma yourself. And then other things in childhood and early adolescence will lead you an increased risk of developing asthma. So there's a genetic and an environmental aspect that are coming together to change how your immune system reacts to what's going on. Some viruses will mean that you're more likely to develop asthma, and there are some viruses that are actually protective against asthma. Unfortunately, following COVID, lots of the lower level viruses that would have been protective against asthma were not exposed to our children and to our young adults. And now we are seeing a massive increase in asthma, unfortunately, because of this. Also, pollution can change how your body reacts to the environment, and then your body can overreact to certain allergens, causing these horrible symptoms that these patients get.
So for a normal person, can you point out those specific symptoms they can have, just like wheezing, tightness in the chest, something like that? Can you explain a little bit about it?
Yeah, of course. So with asthma, you may not get the symptoms straight away on seeing the allergen, or you may not realize you've been exposed because you have an instant reaction and then you have a delayed reaction. So wheezing is very common. That's a high-pitched whistling noise that you can get in the chest. Also coughing. Coughing can be worse, particularly at night and early morning when your body actually is making its lowest amount of steroid, which would be protective against those symptoms. Other things that would happen is that patients, when they get a virus or they get a common cold, will actually be more symptomatic because there's a low level of inflammation within the airways that they've become used to, and then something extra is coming along and making their symptoms much, much worse.
Right. So what is the treatment for adults for allergic asthma?
So the treatment is the same for sort of our children, adolescents and adults. What we want to do is obviously avoid the exposure of the allergen if we can. So obviously if you have a young person or you're an adult that is very allergic to cats and you've got 4 or 5 cats at home, we would urge you that this is probably not the best thing and to try and avoid having that exposure all the time. But the mainstay of treatment for asthma is actually inhaled corticosteroids. And a lot of people will not take their treatment continuously, thinking that actually once they've dealt with the overall asthma exacerbation and taken the treatment, they don't need it long term. But that inflammation is ongoing within the airways, and they need to take that medication all the time to dampen down that immune response. The other thing that we give is something that relaxes the smooth muscle to help open up the airways. So bronchodilators in combination with inhaled corticosteroids. Unfortunately, there's a proportion of patients that even despite being very adherent and taking their inhalers appropriately and properly, still have symptoms. And by this, I mean that they are still not able to do the same things as their peers. They stop themselves exercising, they can't do a game of football. And these patients, we now have treatments that actually switch off what is driving the body's immune system to be overreactive. So for allergic asthma, we have molecules that block the IgE that actually can induce asthma remission. For patients that have a different type of allergic asthma, we have drugs that patients can have injections sort of as least as 8 weekly that also switch that process off, so actually can induce proper remission in asthma and turn off the biology. So it's a really exciting time for allergic asthma and all types of asthma, really.
So it was so fantastic to hear that from Dr. Rachel about asthma in adults and as well as in kids. I think it's a continuous process which starts in the early age and goes on till the adults. I think we call it as atopic march, which starts with the early age after the birth from the skin, then to the GI tract, then to the allergic rhinitis, and then finally to allergic asthma as such. So that's fantastic. Now,
can I ask you about one thing we haven't talked about is food allergies?
Yes.
So how would somebody know if they have a food allergy?
So as Dr. Hala already said that this is an immune system's response, which is unwanted, untoward response to a normal thing. So if I'm taking some food item and I'm developing some symptoms which come immediately after taking that food, and which can be in the form of vomiting, diarrhea, stomach pain, constipation, all these can present if immediately after taking that food, particular food, which the mother can correlate very well, that it comes after that every time. So we think of food allergy. So this is an unwanted response to a normal thing, or normal food, rather say that.
And if my child has allergy, does that mean that they have a problem with their immune system?
No, actually, it simply says that immune system is normal, but it has not been modified. To say that we are born with a Th2 type immune system, Th2 cells are there. So when we get infections, they change milieu from Th2 to Th1. So what that means we are getting our immunity, we are fighting with the infections, we are having memory cells. If we don't get infections and we are exposed to the environment, which is urban environment, we are not going out and playing with other kids, we are not getting infections, we remain with the Th2 type. That means our body will respond in an allergic way and will recognize the normal protein as an allergen and will give the response. That doesn't mean it's low immunity. It simply says unwanted response from a normal immune system.
Okay, and what about celiac disease? Does that mean that I have sort of allergies if I suffer with celiac disease?
This is a very common question actually we all have, that wheat allergy, people correlate it with the celiac disease actually. Same way with the lactose intolerance, people correlate it with the milk allergy. So milk allergy and lactose intolerance is totally different thing. Lactose intolerance means our body doesn't make enough lactase enzyme to digest the lactose, that's it. It's not an immune response. So the more milk you take, the more problem you will have in the form of stomach pain, diarrhea, flatulence. Now with the celiac disease, it's an autoantibody response. It's not an IgE response which comes as in allergy. So these two have totally different mechanism and they are not same. Celiac disease and wheat allergy is totally different. Wheat allergy would be IgE response to any of the 4 proteins which are found in the wheat. So they are totally different. So when somebody says I'm allergic to wheat, actually he doesn't say that I'm having celiac disease. So somebody who says I'm allergic to wheat and my disease is celiac disease, it's not true then. So I think we had a very nice discussion about how the allergy is present, then what happens on the skin when the allergy comes to the baby. Then we move to the asthma, which starts in the childhood and goes to the adulthood. Dr. Rachel explained that very well. And in the end, we discuss about the food allergy as well. Before we end, I would like to say thanks to all of my colleagues here And I would like to say that in our Saudi German hospital, Dubai, we have advanced center for the pediatric care, mother care, and advanced orthopedic trauma center, which has opened new in Dubai. And we are equipped to handle all kind of emergencies related to allergy, as well as other treatment modalities are all already available here. So we are here to help and guide you. Thank you so much for joining us for this podcast with Dr. Rachel, Dr. Mirvat, and Dr. Hala. So I would like to thank you again. Thank you so much.
Thank you.
Saudi German Hospital, caring like family.